This is a real honor and a pleasure for me to be able to introduce our speaker, Dr. Tatjana Kobb. Dr. Kobb is a medical director, global executive, and researcher with experience spanning work with the United Nations, World Health Organization, private corporations, academic institutions, and philanthropic organizations. Just quickly, because she has an extensive resume, she is currently an adjunct professor at Northeastern University in Global Studies and International Relations. She is also currently an advisor in the master's program in health leadership at McGill University. She is the founder of Boston Sustainability Advising, which is a consultancy company working globally with governments, businesses, and nonprofit organizations to implement programs in line with the United Nations 2030 Sustainability Development Agenda. She has worked in Europe, in the Mideast, in the US, and Canada, and now in China. She is a proud member of the Newton Rotary District 7910 Club, and I am turning it over to Tatjana. Thank you so much for being here.
Dear past President Susan, dear past President Joyce, and all the members of the Rotary Club of Brookline, and my fellow members, past President and current President, Sue and Ron, and all the community members, Rotarians from the Brookline Rotary Club, and everyone else who will be listening to our presentation today. It's such a pleasure and an honor to address this audience and share some of the thoughts, experiences, and perceptions that I might have had in the past period during the pandemic. And I'll be happy to share some of the slides that might be more interesting to view while I'm speaking as well. First of all, I would like to thank Sue Pagini, who has, first of all, welcomed me in the Rotary Club of Newton when I joined, and extend the sharing in our caring community of Rotarians and recommend what else we can do from different places of the world. So I continuously feel connected. And if I can start with sharing of the screen, I'm gonna go to the presentation. And that will mean from the beginning, okay. Can you see everything, please?
Yes.
Okay.
Looks good.
Thank you. So Rotary connects the world, and that's the theme of this year that we are passing, and the convention that will be taking place over the weekend, thankfully, will be even more connected due to the pandemic, but in the same time, we can utilize all of this to understand how we turn struggles into possibilities.
So Tatjana, I'm sorry to interrupt. I just want you to know that you're using presenter view, and that means we all see presenter view. I don't know if you want to do that or not.
Oh, it's okay for me,
okay.
But I can use the presenter view. I can just use.
You're using it now. You're already in presenter view.
Yeah, just 1 second. Okay, yeah. Let me just use the normal so you don't get with all the shown things. So just 1 second. Thank you, Sue, for that. It will be better to view it like a presentation, not just with everything in bits and pieces. I would like to share in the next minute some thoughts about how it was experienced in China from the beginning of the pandemic, but in the same time, what I see as possibilities for Rotary, what I see as how much more we can utilize what we do with the global health action that we have in every aspect of what we do in Rotary. In my role as a cadre technical advisor, I had been given the privilege to volunteer in this capacity. And during this time, since we moved in China, I continued trying to understand, learn, and see what else is possible in places where Rotary is not that present. So I would like to ask everyone to interrupt me or ask questions if you want to have the questions at the end. But feel free to interrupt me if you'd like to do that. So the next slide, it's giving you an understanding what's the real life now in China. We have passed the urgency and emergency of wearing all the time masks, being constantly under the threat and pressure that we need to keep social distancing. We need to be aware of how to preserve the health and well-being of everyone else besides us. For me to take the step to feel comfortable with everything was challenging. And I've shared an article that I wrote at the beginning of the pandemic when I was just returned to China after the travel that we had to the Dominican Republic in January. In that time, I felt very frustrated that I couldn't contribute. I couldn't volunteer as a medical doctor. I was not able to be the American citizen and activist that participates and helps the community. But that was because I didn't understand also how much in China, with the central governing, they have well organized all the volunteers within the public administration to have a great response and be very present in each and every community. So they did not have a presence of police that was making sure that everything is in order, but we did have people come and knock on the door and check temperature and ask if we are okay, if we have moved somewhere, if we had visited. We started using on WeChat some of the tools that are available, and WeChat is an application that is like a WhatsApp or kind of like a Facebook, but it's mainly used in China, and it has payment options as well. With further time in the pandemic, we moved into a period when there was a QR code that was developed on Alipay that traces and justifies why you have it green, that you have not been exposed to a contact, because the tracing of contact was in place from the very beginning in China. And that's why, for example,
Whoops.
Zhejiang province.
Good. It's good. We lost you for a minute.
Oh, okay. Yeah, thank you for that. Yeah, please react because I'll repeat. So it is important to know that we are 57 million province, that is half of Turkey, for example, just as a parallel, and we don't have a single case of COVID that is new in the past more than a month. The measures still continue to be for social distancing in the public in the public spaces, but as you can see, there are gatherings, there are activities that take place, and going back to the times when I was becoming a Rotarian, I couldn't imagine what else I can do in a country that maybe does not have the activities that our club, for example, has back in the US. I couldn't see what exactly I can do as a professor teaching in the Masters of Global Health and Global Studies and International Relations, how I can help more the students here, because the university back at home in Northeastern was so much more supportive, and I got much more information from that university at the time than what I was getting here from the Chinese university, the Zhejiang University, where we are based at. But that's just because the culture is different. They don't share that much, and everything is centralized, and not everyone is taking the risk and stepping in and sharing more. So sometimes I was the one accumulating information and sharing with everyone that I had in my community, because I do believe that health is central. And now with this pandemic, we have seen that the health is placed centrally, and it's interconnected to all of these 16 other sustainable development goals. And I'm using it as a visual because we need to understand how we can utilize all of it with the Rotary International, because we are over 100 years old organization. We are in the founding days of the United Nations. 75 years ago, we were instrumental. And no matter that I'm not able to participate in Rotary meetings here in China, I was just sharing with Susan and Joyce earlier when we had a conversation a couple of weeks ago that we almost participated at the 100th years anniversary of the Shanghai Rotary Club. Unfortunately, my husband was too busy sorting some things for his work, and we ended up leaving late from the hotel, and we were in the traffic jam. But that doesn't stop us to act and work with the causes that we support. And I truly believe in what Rotary stands for. And that's why I'm very proud of what our club, as Rotary Club of Newton, has taken actions in feeding the fight in Boston. And I try to share that experience with my other home country, as I am from North Macedonia. And I supported the activities in there for Rotarians to initiate more participation in supporting the work of the healthcare workers as well. I have to say at this moment that we have a very good understanding how much safer we are from the next wave here in China, even though we have new cases in Beijing, because immediately the actions are there. Immediately, the measure has never changed about wearing masks in public. This COVID-19 global cases report, this is an old photo that was from Johns Hopkins. I used it so much more at the beginning because it was source for me to understand how it's developing globally. But we had on WeChat on a daily basis, new cases, statistics, everything. We even had a tracing on how far from where we live there might be another case. And when I moved from, when I arrived in China from the trip that we had with my daughter in January, it was 26th of January, and I'll land on this page about a visit at the UN, just to think about inspiration, what we can take from these things, what we can learn to extend and support the other generations, as I was just inspired with the changes that the late member of your Rotary Club now has initiated at the time that he was very active, and what we can take as responsibility to make a difference now. So what I've mentioned from the previous statistics and understanding what was happening before and what are the cases now in China. During this crisis, we faced a reality with my family that my daughter had to be in an emergency situation. My father had to go in a surgery. We had these constant challenges of trying to understand, am I leaving? Am I going to Macedonia or to Boston? And in the same time, feeling that I am kind of trapped because now we don't have any flights with the US, direct flights. Since 1st of June, we do not have an easy access through Hong Kong to leave. So these are challenges that we are facing, even though we are in a very comfortable and privileged situation. We are sitting in Zoom meetings, we are exchanging experiences and trying to motivate others and support groups that we want to have them benefit from this. That's why I'm proud that Rotary International has launched a COVID response funding that has been helping internationally. And that's why I continuously try to see opportunities to connect with other actions and projects that are related to Rotary, because the economy depends on how much the civil society and the community is healthy, how much we need to understand and investigate what are the real causes of the COVID. I would recommend reading Professor Henry Mintzberg's blog that has some very insightful thoughts about rebalancing actions and things that are needed for us to galvanize some different other activities to prevent from future challenges that will come out of this COVID crisis that had opened other questions as socioeconomic determinants of health, as why the maternal mortality of Afro-American women in the US is so much higher. We talk about working with cadre technical advisors, as I am one of them, evaluating as volunteers at home projects and going and visiting projects abroad. But sometimes we also need to understand even more how much these areas of focus, the maternal and child health, the basic education, the community economic development, peace building, and financial management as well, we need to revisit and understand better what we are learning while we are going through this crisis of COVID, and what else, for example, I can be the one who can share more with others from the experiences learned in China. I'm just throwing a few photos from the birthplace of my dad, that is Ohrid Lake. And I want to say that sometimes it seems that it's a marathon, but it's worth it. It's worth it to do things that can change people's lives. Our head of the World Health Organization has been attacked so much in the past period. There are institutions and organizations globally that sometimes might be able to improve things, but sometimes they're doing the best that they can. And I believe that Rotary International can utilize this momentum. For example, me being here in Zhejiang province, your club has utilized in the best possible way to bring me in and open the floor for questions. So not only I can bring some of the pianists that are associated with me to perform for our Rotary Club of Newton, but also talk about mentorship for sustainable development goals, see how we can expand on this and utilize more actions to more purpose-driven lives and well-being of our community of Rotarians, and to emphasize the importance of how much we are connected and how much the public health in one part of the world is global health overall. I'll be teaching during July and August the global health critical issues at Northeastern University for my master's students. I almost ended up in North Macedonia 2 weeks ago to go and visit my dad that had a couple of surgeries, but he's recovering well, and he's waiting for the next one to have a bypass. But I'm very saddened at this time, feeling so comfortable here in China and knowing that I'm not exposed to the virus in such way, when in North Macedonia at the moment we have 200 cases per day. And it's a country of 2 million people. It's a country that has really flattened the curve, but has not taken good care in following up on that, and has not suppressed the religious leaders at certain time when they just encouraged everyone to continue with the religious practices and gatherings. And now the economy reopened in a way. There is an election that is in a month from now. So all of this is steering another challenge in that community. And I'm also able to share a little bit more about that if you'd like to know. But for me, it's very, very important to understand what we can sooner learn from other places and start implementing quickly, because the masks could have been worn everywhere from the beginning and made mandatory, as they were in South Korea, Singapore, China, and some of the other Asian countries. So I'm open for questions, and if I have missed some of the points that you wanted to hear more about through my conversation or my presentation, please go ahead. I'm here to continue the discussion with all of you. And sorry if I have taken a little more of the time.
No, you're
Not at all.
great. And if anybody wants to speak, just turn on your microphone. George, I turned on yours, and I'm going to turn on Chobi and Gloria as well, so that they can speak up if they wish.
Yeah, and I can stop the sharing of the screen if that's better, so we can see each other on the shared screen.
Tatjana, that was really terrific. Thank you. I wanted two things, I guess. One is testing. There's been a lot over here in the States about testing and the lack of testing. And I wondered what was the situation in China. And the other thing is, here in the United States, there is so much information and different information that can come at you. I am assuming in China that is less so, so that people are not as apt to get mixed messages because they've got one source of information which makes it easier to control things. Do you think, first of all, the testing, what's the situation there? And second, what are your thoughts about information distribution?
Thank you, Susan, for the question and for pointing out these two topics that we can focus further in our discussion. In regards to the testing, Wuhan has conducted millions of tests now to test the whole population. In the population of China, I don't have the exact number of how many tests have been conducted, but I do know that in the way how the first steps are taken at the beginning and how the screening is done and tracing of contacts, that is the epidemiological way of setting a standard which actions need to be taken first, second, and third in order to understand how many people you test and what is important to be done at the very beginning. So for example, if you have a very good measure of wearing masks, understanding who has been exposed, if the clusters, the first clusters are completely closed and there is no access to anyone to go or leave the place, then you have a lot less exposure and you have a better manageable situation where you can understand who needs to be tested further. And introducing more broader testing later on, it's not that helpful either, because if you don't test at the very beginning, you are in a risk of letting it being spread. And especially, I have witnessed what happened when I came in China on 26th of January. I was wearing mask, I was tested with temperature. There were 6 points from Shanghai airport to the place where I live in Haining that had 0 cases at the time, where we were checked and it was understood where we are coming, where we are heading, did we have a contact or not with the cluster that was at the time in Wuhan, and trying to limit exposure to the people that we will bring it into Haining. I have a colleague who is a public health professor who joined from Ethiopia, the New York University, in March. It was beginning of March. There was nothing at New York airport. I have a student, I have a colleague who is an alumna from Northeastern University that works for CDC. And I know when she started working at the Boston Logan Airport. So testing is very important, but it needs to be conducted when it's needed and in the way it's needed. That's why at the very beginning, there were countries, including the US, that were not quickly implementing the steps of testing. And that was something that was missing at the start. In regard to your second question, I don't know if I don't know if I covered everything regarding to the testing that you had.
Thank you.
So yeah, so can you just summarize what you would like me to focus with the second?
That I'm assuming in China there is a singular source of information, and so it makes it easier.
Yeah. So access to information was scarce at the beginning. Especially for us as expats in a town, I will say town because it's 1 million people, which for China is very small, even though it's a Boston-sized city. We are very few expats because before the holidays, everyone left that was working at Zhejiang International campus here in Haining, and there were just many few that returned back before the lockdown. The Chinese New Year that was on 25th of January, that happens to be my name day in our calendar, was not celebrated. So Chinese respected that very well. So they stayed at home. And during this holiday, usually everyone goes back to their hometowns. And when the lockdown was introduced for some places and where people were not allowed to go back, that meant that they stayed there. For us, not having direct communication locally with expat community, because there were none at the time. I had some information from colleagues that are from the Edinburgh University about the cluster that developed at the end of December, which was shared with WHO at the time. And I started receiving more information from Northeastern University because we do have a big population of Chinese students as well, and also international students that need to be informed well of what is happening globally. So at that time, and the American Embassy was sending information also. During that period, I received more information from abroad than from within. But when the period of this holiday finished, we were contacted also by the dean, we were contacted by other people, and then in same time in these WeChat groups during the past period, as they started to report the cases, and on the daily basis, they would share information. So we had information coming from several different sources that we could check and understand better. There was a big wave that happened on social media that was related to the reporting. And when the article was published, I think it was in the New England Medical Journal, it was 30th or 31st of January. It was about the transmission of the virus from human to human. That piece was very important because in knowing that can be transmitted from human to human, then you know what else you need to put in place as measures to prevent it from spreading it further. So during that time, it was addressed the way how things were handled, and a lot of Chinese people, many intellectuals and everyone that we know were very vocal about the doctor that has reported that and how all of that has taken further action. So I think that having central information about what is happening from the government is one thing, but in the same time, the communities are sharing information. We had many volunteers, community workers come, visit, deliver information, ask for information from us. There were in the different gated communities, you cannot go if you don't live in that place. There were guidelines related to how often you can go to the supermarket. So in our city, only 2 supermarkets were working, and from one family, only every second day, one family member could go to a supermarket. So there were centrally sent instructions and clear guidance that is very useful and important, but there was this big group of community volunteers that would implement all of that, and all of it was channeled through the public administration, which I understood later, because they were changes in the priorities of work that they had, and many people working in different other areas, they started doing different voluntary work in order to fulfill the role that many NGOs in the US or other places have. And in this way, it's centralized information, clear guidance and direction, which I was becoming very confused and stressed when it came to the US, when everything was left to be, first of all, oh, it's not on a central level, now it can be on governor's level, and if it's not on governor's level, now every mayor will be deciding. And then you see how sometimes civil society tries to act and do more and takes actions to inform the citizens. So these are just different societies and different way of how things are organized, but definitely it's very important if you see a committed leadership that wants to address the problem and wants to make the health most important, the health of people and access to services, because everyone who could go and ask for tests and share the symptoms was going to be tested. No one would have been denied treatment if they needed to continue for treatment. We had just 4 cases in our city overall. It was 1 case and then 3 more, but all of that was also because of the preventive measures. Later on, there were some cases that were so-called imported cases that come later. So there were several cases like that. But the system had organized well from on the city level that there was a hotel for a quarantine. There were measures that were taken in advance in place, clear guidance of what needs to be done, how, and who takes the responsibility. And from the very beginning, the state was paying all the costs for the quarantine of everyone that needed to go in quarantine. And then later on were introduced other measures where everyone flying back into China is in mandatory quarantine for 14 days and they have to pay it themselves. But as the very start for everything, it was very important that central direction and clear information in making the measures understood and applicable to all, and in the same time, people having the responsibility for others. I think the social consciousness, it's very present in trying to prevent the spread to others and having the responsibility, which at the moment I've heard from our kids. One of them lives in San Francisco, the other one is in Cambridge, and that they are worried at the moment how the next steps will be, because they say when it was quarantine, I knew who is out on the street, who is not who wears mask, not wears mask, or how much we need to disinfect and so on. Now it seems like we don't know how many asymptomatic cases are there. Is everyone really taking all the measures or not? And it's same way in North Macedonia, that you can't open up everything and just let it spread. We know from Sweden that that approach was not really successful and helpful. And even though it might be more liberal, it's limiting the health as human rights, and people need to be responsible for all.
Any other questions? And George, you have to give me a time frame here.
Well, I'm looking at the clock and it says it's 12:53. We usually run at least until 1, often until 1:15. So I think there's plenty of time for any more questions, if there are any more questions.
Sue Pagani's hand up.
Yeah, I have a question. You know, Tatjana, we found here in the United States that there's been a huge disparity between Black people and other people, other colors, on their likelihood of getting it and dying from it. I'm wondering if within China, if there are disparities like that they've seen in the different populations, because I know China is so big that there are lots of different ethnic groups, and I'm just wondering if they've experienced anything around that.
Thank you for asking that question. And in regards to the main focus in these past years and in the coming years in China, one of the main focus areas is eradicating extreme poverty. So when you have a country that works on eradicating extreme poverty, that means that there are areas that are in need of more assistance, addressing the necessities of that population. I'm not at the moment in possession of some more information that I can share, But I do have conversations and collaboration with a colleague that teaches global health at Wuhan University, so I can check and ask for more information on that. Like, for example, a couple of days ago, another colleague, cardiologist from the University of St. Cyril and Methody, asked me about the testing, and I tried to find more information and share the latest report that was shared with me. So if you have any more questions, anything else that you might be interested in and I might not be able to supply today, I'm more than happy to follow up and check and see, because I'm bringing guest speakers in my global health critical issues class for the Global Studies in International Relations at Northeastern University. And I'm expanding on the discussion about the global health and what else we need to take into consideration. That's why, for example, I spoke with a senior consultant of the World Health Organization about migrants and refugee health, because sometimes we are so centered about what's in our community, what else we are doing, and what can we do better. But there's so many other marginalized groups that have been just completely kind of forgotten in this period. And I think that what has happened in the US with police brutality and the latest protests is just bringing to the forefront the burning topics about socioeconomic determinants on health, and how that is different in various places, even in one city in the US, not to talk about different states and different perception on what should be accessible as universal health care. And I think that that's another topic that Rotary will have an incredible role to play in the future, because with the 75th anniversary of the United Nations celebration this year, and having the pandemic and having Rotary International working on eradicating polio, we do have a great momentum to start working furthermore on universal health care, because health is human rights.
Tatjana, I wanted to ask you, one of the bits of information that's floating around in the US is they look at the comparative numbers of cases in the United States and in China, and they say, oh, well, China's not, they're lying. You know, they're withholding information like they did in the very beginning. So do you find the numbers credible in China, or do you think that there's a larger number that they're simply not reporting?
I think that the reporting has been correct from the beginning. The adjustments and changing in reporting, what is reported and how, and the statistical method of the analysis have changed in many countries throughout the period as they were using different methods. But in the same time, I will definitely say that from what I understand and what I get as information, and I do check and have conversation with other colleagues, the reporting cannot be done in unscrutinized way. So the reporting has to be in line with the principles. And from the beginning, what it was reported from China, it was correct. It was reported a cluster of cases in Wuhan that started in December. What was not correctly reported further, it was the timing when it was recognized that it was transmitted from a person to person, from human to human. And that prevents the next measures that can be done from the very beginning for preventing from spreading it further. But that's why, for example, now when we have a new cluster developing in Beijing, all the measures are in place. I'm not confident that many other countries will implement those kind of measures immediately, where there will be a very quick spark of new clusters. And there was a recent analysis that I just saw on LinkedIn yesterday, I think it was, that at the moment, only 15% of the states in the United States are doing better. 45% of the states are doing worse in number of cases and all the rest. that's why I think that it is important to give the credibility to the organizations that are committed to fight the pandemic. It is important to collaborate and fund the institutions that stand in the government for that. The Center for Disease Control as an instrumental organization could have played a better role from the very beginning if they were given the opportunity, because they do have a capacity, even though they have been underfunded for the past years. And that's why I think that some of the governors have taken great leadership roles to change some directions and take in their hands the responsibility to do more. And I hope that on a daily basis, there are reports that show what are the new cases in everything. And I can share with all of you from North Macedonia, from Qatar, where I used to work, and from China, how things are reported here. And if you get that kind of comparison on a daily basis in order to understand how much the healthcare system is under an impact for being exhausted. Like at the moment, we do not have that kind of a situation in China, but in North Macedonia at the moment, they're mobilizing doctors from other cities to come in the capital in Skopje, because the infectious disease clinic is having doctors that are very exhausted, and some of them have been infected and they need to continue their rehabilitation and recovery. So I'm just worried if we are not taking all the measures during this period to strengthen the measures to prevent from the spreading further in the US by engaging in the conversation of the bilateral conflict between the two countries or the global and the US, we are missing a momentum where we can really make a difference and prevent more lives to be, from being lost, and be able, the healthcare workers, to support better the society in the United States. Because we should not forget that, for example, Women's Brigham Hospital, and I've learned this last year at McGill University, has the funding, the total funding of the whole research fund of Canada. So it's not that in the US we do not have enough funds that go into the healthcare institutions, but it needs to be understood what do they fund and for what are the priorities. The preventive measures and preventive medicine is not fully available and accessible for everyone in the US. And prevention is much more cheaper than cure. In preventive measures in education, we are able to do a lot more. Ron is.
Yeah. We'll do one more question because I know it's 1 o'clock, even though this is fascinating.
Okay, just a quick question. In the States right now, there seems to be a correlation between wearing masks and not wearing masks on which political side you happen to be on. Is that something that's duplicated in other countries? Is it the same alignment with the, I don't know, here we call it the right and left. I don't know what it might be in other countries. And I'm assuming in China, it's pretty monolithic, but are you seeing any of that? And are the efforts that are being made by the health community, are they being designed to address those differences? Anyway.
Thanks for that question, Ron. One unhelpful piece in regards to wearing masks was from the very beginning that there was not straight, concrete direction that masks should be worn. One of the reasons why it was different in China and the other Asian countries here is because sometimes people do wear masks here for the pollution or for prevention from allergies and so on. So it's more regular present in other times. And when it was the start of the pandemic, it was mandatory. So you cannot go out without a mask. Why it was politicized in some places? I would go back to the period when the masks were supposed to be saved for the doctors and nurses. And this is a moment when a student of mine from Turkey was visiting a hospital in Boston. He was visiting a colleague, and it was during the start of the pandemic. I think it was March, second half maybe. And he said that even doctors and nurses do not have masks inside the hospital, and he was not able to wear masks himself. The reason why in different places of the world was first addressed the importance of not going and stocking on masks in order the masks to be available for the healthcare professionals, because many people start to buy N95 masks, buy surgical masks and so on. But I think that piece was well addressed with homemade masks, that people started to make homemade masks to be worn in many cities where we have activists in the US. But why it was taken to be politicized, it's just because we have a president that would go and not wear masks anywhere. We do have a very top leader that went into the Mayo Clinic without wearing a mask. So we do have situations where we do not have a consensus that we need to respect the law and everyone should obey. Is it political in other places of the world? I would say yes. In some places, the religious groups are trying to be more present, saying that you don't need to wear masks because there are different other reasons why the God will help you and so on. But I think that sometimes people need to understand the bottom line, that first of all, you need to take the responsibility for others. And it's not just about preventing you being exposed, but in the same time, preventing others from yourself as an asymptomatic case, maybe getting contaminated, getting exposed to the disease. And just yesterday, the person that leads the Last Mile Health, who is also a professor at Harvard Medical School, he shared that 50% of the car accidents deaths are prevented with a seatbelt. So if 50% can be prevented from spreading the COVID further, why are we not wearing masks? I mean, it's something that is just very logical.
Because the same reason that 50% are not wearing seatbelts.
Seatbelts are a law, though. That's interesting. It's a really interesting comparison,
yes,
Tatjana.
Yeah. Okay.
Tatjana,
thank you so much.
Thank you.
We will now finish up with the check-in time amongst our club members that we did not do at the beginning. So how are you all?
Thank you so much.
Thanks for coming, Sue.
Tatjana.
Hi, thanks. I'm gonna check out now.
Yeah.
Good to see you all.
Thank you.
care.
Thank you so much.
And Ron.
Tatjana, thank you. And best of luck to you there.
Sharon, I'm going to send you a little text message in just a second.
Okay.
I have a question for you. Bye, everyone. Thank you.
Bye. Thank you.
Is everybody fine?
Would you like
Anybody
me to leave?
not
Or
fine?
would you like me to stay?
Well, I guess what my question was something that I can really that doesn't seem to be manipulated too much is the death rate of people who do get hospitalized. And I didn't know what it was in China and if it's lower than here, and if it is lower than here, if they have any thoughts on why it would be lower than here. Last week we had somebody from India that said that Indians have a stronger immunity than Americans. And I thought about that, and at first I thought that was kind of ridiculous, but as I thought about it more and more, I understood why he said that, and it made perfect sense to me. So I don't know if you had any thoughts about that.
Thank you for the question, Don. I'll be more concise and take less time. Of course, the statistics as a field is sometimes used to present different things from the different lens. And it can be confusing and manipulative sometimes, depending how it's representing the data. But in regards to the death rate and the comparison between the countries, the death rate depends in which state the patients are hospitalized, how soon they have access to go and be diagnosed, and how much they have been encouraged to go. Because many times the patients are not encouraged in some countries to go and seek help if they have some of the symptoms. And only in the later stage they are encouraged. Even though in a couple of days, on 21st of June is the World Yoga Day for the 6th year. And yeah, maybe in India, they do practice more mindful practices, and they might be more holistic in the way how they treat the symptoms of the disease. But I cannot share the exact data on the death rate in China and in the US. But I can go back and look into some more information and follow up with you if you would like to receive more of that analytics. But my understanding, and from what I've learned also from North Macedonia following up on the past several days, especially because the cardiosurgery clinic where my dad was treated when he had his carotid surgeries, they had a positive COVID patient that came with a ruptured abdominal aorta. Ruptured abdominal aorta is a massive condition. So what happened is, and I'll share with you the article as well that got published just immediately after. What they did is they had a surgery for the patient. So they had a prosthesis in the abdominal aorta, and afterwards they put the patient on filtration of the blood, because the storm of the cytokines, what is happening in the blood, is developing their immune response. And sometimes that's why we are seeing now more information about how the blood vessels are reacting and what else is as symptoms of the COVID, and it's not just what is happening in the lungs. So they filtrated, and the filter that usually takes 48 hours to be clogged, it would clog in 12 hours. So by the 6th day of treatment, post-operative, the patient was COVID negative. Patient is discharged. I'll share with you the video if you like to look at it. But all depends on when the patients are hospitalized, and the death rate depends on the severity of their situations when they arrive and the preconditions and other chronic diseases that they have.
And I think Phil Sandler has a question. Go ahead, Phil.
Well, Lucy and I are still in Florida because of the virus, but Florida has been pretty much opened up. We've been pretty much staying at home or just taking walks in our neighborhood away from other people. But I did go to Costco recently, and almost nobody was wearing a mask. And almost everything in Florida is now reopened, even though we're not participating. I'm wondering, what is the situation in Brookline? First of all, is wearing a mask mandatory in Massachusetts when you go outside? If you go into a grocery store, is it mandatory? Whether it's mandatory or not, when you all go to grocery stores, do you notice most people are wearing masks? What's the situation?
Not in New Hampshire. In New Hampshire, half the people don't wear masks.
Oh, live free or die.
Yeah.
Yeah.
Brookline is saying that you must have a mask if you're going into a store or restaurant. Are people abiding by it, Phil? Not completely. I have seen more and more people without masks these days, but it depends, you know, particularly outside. People, I see a lot of people not wearing masks. In the stores, in enclosed places, I think it depends on how rigid the shopkeeper or restaurateur is in terms of saying you can't come in. But they're doing better if you're going inside, because Brookline is saying you have to. but that's it.
Massachusetts, you do not have to wear a mask outside if you're 6 feet apart from people. So it's an either or.
But in a store, you do wear a mask and people are wearing them, unlike here.
Right.
Probably better. Yes. They opened the farmer's market 2 weeks ago, and you have to wear a mask in the farmer's market.
Yeah.
Well, there was a time when in France, for example, when our other son just went after graduating in Canada a month ago. It was not mandatory to wear a mask, but they had to have a paper from the police that they cannot go within a further distance from the place that they live. So he couldn't leave the place. So you might not have to wear a mask, but you are obliged by the law, and there were strong penalties if you are found in another area.
Phil, any idea when you guys are going to come back?
Probably around July 6 or 7. Also, here we're worried about hurricanes. Our place is right next to the water. So we've been getting scary warnings about hurricane preparation. And in our development, if there's a hurricane, they have mandatory evacuation. So that's another worry.
Be safe, sir.
Yeah.
Whatever is true, whatever is honorable, whatever is just, whatever is pure, whatever is pleasing, whatever is commendable, if there is any excellence, and if there is anything worthy of praise, think about these things, and peace will be with you.
Thank you, George.
Thank you.
And the non-chat box. Keep the faith, baby. Spread it gently. And walk together, children.
Oh. Thank you,
Very
George.
nice. Thank you.
Namaste.
Bye-bye.
Namaste. Bye, everyone.
Till next week.